Hi all, welcome to Nursing Group. Uh, this auspicious occasion, we are taking Nursing 9 Bites. Very firstly, I would like to tell about this Nursing 9 Bites. What does this means? It is a crash course regarding all the courses which are present in our nursing stream. Okay, so this nursing 9 bites will give you a knowledge regarding the nursing courses, especially will make you to get a good information how to crack the examination, especially university examination, board examinations. So for all the nursing students, this will going to be a very beneficial. So please watch this live every day 5 p.m. Continuously we are going to take this nursing 9 bites for 9 days. Very first, I would like to wish everyone happy Navratri. ಎಲ್ಲರಿಗೂ ಹ್ಯಾಪಿ ನವರಾತ್ರಿ. ಈ ನವರಾತ್ರಿಲಿ ಈ ನರ್ಸಿಂಗ್ 9 ಬೈಟ್ಸ್ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಒಂದು ಕ್ರಾಶ್ ಕೋರ್ಸ್ ನಾವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದೀವಿ. ಇದು ಎಲ್ರಿಗೂ ಉಪಯುಕ್ತ ಆಗುತ್ತೆ, ಎಕ್ಸ್ಪೆಷಲಿ ಬಂದು ನರ್ಸಿಂಗ್ ಸ್ಟ್ರೀಮ್ ಅವ್ರಿಗೆ. ಈ ಎಂಟೈರ್ ಕ್ರಾಶ್ ಕೋರ್ಸ್ ಅಲ್ಲಿ ಏನಿರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ರಿಗಾರ್ಡಿಂಗ್ ನರ್ಸಿಂಗ್. ಓಕೆ, ಆಲ್ ದ ಸಿಲೆಬಸ್ ರಿವ್ಯೂ ಇರುತ್ತೆ, ಎಕ್ಸಾಮಿನೇಷನ್ ಟಿಪ್ಸ್ ಇರುತ್ತೆ. ಸೊ ಪ್ಲೀಸ್ ಎಲ್ಲರೂ ಕೂಡ ವಾಚ್ ಮಾಡಿಬಿಟ್ಟು ಈ ನರ್ಸಿಂಗ್ 9 ಬೈಟ್ಸ್ ನ ಬೆನಿಫಿಟ್ಸ್ ನ ತಗೊಳ್ಳಿ. ಸೊ ಅಂಡ್ ಅಗೇನ್ ನಮ್ಮ ಚಾನಲ್ಗೂ ಕೂಡ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ. So already ಹೇಳಿರೋ ತರ here in this particular crash course we are going to see today. ಇವತ್ತು ನಾವು GNM ಸ್ಟೂಡೆಂಟ್ಸ್ ಬಗ್ಗೆ ಮಾತ್ರ ಮಾತಾಡ್ತಾ ಹೋಗ್ತೀವಿ. GNM ಸ್ಟೂಡೆಂಟ್ಸ್ ಸಿಲೆಬಸ್ ಏನಿದೆ, ಅವ್ರದ್ದು ಕೋರ್ಸ್ ಏನು, ಓವರ್ ವ್ಯೂ ಆಫ್ ದ ಕೋರ್ಸ್ ಅಂಡ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಇಯರ್ ವೈಸ್ ಸಿಲೆಬಸ್, ಕಂಪ್ಲೀಟ್ 3 years ಸಿಲೆಬಸ್ ಇಲ್ಲಿ ನೀವು ತಿಳ್ಕೋಬಹುದು. ಅಂಡ್ ಅಲಾಂಗ್ ವಿತ್ ದಟ್ ಯು ಆರ್ ಗೋಯಿಂಗ್ ಟು ಗೆಟ್ ದ ಇನ್ಫಾರ್ಮೇಶನ್ ರಿಗಾರ್ಡಿಂಗ್ ದ examination also, question paper pattern also, how to tackle all the tips and tricks I am going to tell you. Okay, next, already we know that it is one of the comprehensive course. Very first we started with the crash course on a GNM course overview. When it comes to the GNM course overview, we know that what is this GNM course. Okay, it is one of the general nursing midwifery, everyone knows that, but why it has been designed and how the course will act. Okay, so all those things will be going to be tell in this particular crash course. Very first we started with the overview of the GNM, right? So it is one of the comprehensive course. Here we are going to get a knowledge and we are going to enhance our skill. Okay, regarding in our healthcare professional, especially you are going to be a staff nurse. Okay, so that and all we can see in the next slide regarding the deep review of the GNM course. When it comes to the first GNM course overview, it is the 3 years plus 6 months of internship will be there, and especially in this only sometimes within 3 years only they will finish it off the internship also. So like that kind of one comprehensive course has been designed for the nurses, especially e-course. This course will be a diploma. ನಾ ಹೇಳ್ದಾಗೆ ಈ ಕೋರ್ಸ್ ಡ್ಯೂರೇಷನ್ ಬಂದ್ಬಿಟ್ಟು 3 years. ಸಮಟೈಮ್ಸ್ ಏನಾಗುತ್ತೆ, ಇಂಟರ್ನ್ಶಿಪ್ ಕೂಡ ಈ 3 years ಅಲ್ಲಿ ಇನ್ಕ್ಲೂಡ್ ಆಗಿರುತ್ತೆ. Sometimes again we are going for a 6 months of internship. And when it comes to the eligibility should be 10 plus 2. When it comes to the other states, we used to tell that 10 plus 2 12. Okay, so the 12 standard, preferably science will be there. Even if you're not in the stream of science also, you can get the admission for this particular course. When it comes to Karnataka, ನಾವೇನ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ನಾವು +2 ಅಂತ ಹೇಳಿದ್ರೆ ನಮಗೆ PUC ಇರುತ್ತೆ, ಪ್ರಿ ಯೂನಿವರ್ಸಿಟಿ ಕೋರ್ಸ್, ಅದನ್ನ ಕಂಪ್ಲೀಟ್ ಮಾಡಿರ್ಬೇಕಾಗಿದೆ. ನಾಟ್ ಓನ್ಲಿ ದಟ್ ನೀವು ಸೈನ್ಸ್ನೇ ಓದ್ಬೇಕು ಅನ್ನೋ ಯಾವುದೇ ರೂಲ್ಸ್ ಅಂಡ್ ರೆಗ್ಯುಲೇಷನ್ಸ್ ಇಲ್ಲ. ಯು ಕ್ಯಾನ್ ಗೋ ವಿತ್ ದಿಸ್ ಎನಿ ಕಾಂಬಿನೇಷನ್, ಆರ್ಟ್ಸ್ ಓದಿರ್ಬೋದು, ಕಾಮರ್ಸ್ ಓದಿರ್ಬೋದು. So you can be eligible with a proper percentage. Okay, minimal percentage will be there for several, according to the category wise also percentage will be there. So according to aggregate of this your marks, you will get the eligibility for this particular course. Then what is the aim of this particular course? We can see now, to prepare nurses who can provide a safe, competent and effective nursing care at hospital. in the community. Okay, so that is the aim. What is the objective of this particular course means we are asking. If someone will be asked means we are giving an answer. What is the aim? What is the goal to get a course, and what you are going to be work? You will get a safe and competent and effective nursing care at the hospitals if we are getting, if you people are getting a proper training through this course means. Okay, or not only in the hospital sector, you can work in the community sector also. Now we can see ಇದರಲ್ಲಿ next whatever the focusing areas. When it comes to the focusing areas, see here what it will be happen. We are mainly focusing on the fundamental nursing skills. Okay, that is when you are going to watch this complete live session, you come to an idea. Okay, this is the first slide. You will also get some bit of things that what is this, what is this. Once you're going to watch this completely, definitely you're going to get the idea. So the first one, fundamental, it is a foundation. Okay, you are going to get the thorough with the skills of a nursing, and you can focus in the area of the community health also. And when it comes to the community, you are giving a education for the people who are present in our community. Okay, there is a bridge between the community and the healthcare sector, so you have a chance to work in the community sector also. The next one is midwifery. When it comes to the midwifery, you are going to treat the mothers. Okay, upcoming mothers, adolescents, and as well as you are going to treat the lactating mothers, pregnant women, so antenatal, postnatal, all the case you are going to give. So there also you will get the highest priority to get a job and all. Okay, so you will well versed in this kind of specialized areas. The next one, medical surgical nursing. When it comes to this medical surgical nursing, it is one of the vast area speciality in the nursing. You are going to treat all the medical condition, including the surgical conditions for the adult people. Okay, so and when it comes to the psychiatry, pediatry, and advanced nursing practices, you are going to treat pediatry means you are going to treat the children's, as well as psychiatry means you are going to treat the mentally disabled people, and as well as you are going to get the advanced nursing practices. Now we can see the career opportunities. When it comes to the career opportunities, first of all, if you are getting this kind of uh, diploma course means definitely you're going to work as a staff nurse in the hospitals, clinical settings. Wherever you will go, you can work as a staff nurse. The next one is community health nurse. Already I told you that you can work in the community health sector also. Okay, so community means what? Wherever the people, okay, it is a group of people located in a localized area. Okay, so there you can also work as the community health nurse, and you can reach the needs of the people, means healthcare needs. You can reach out there and you can provide a healthcare facilities for them and promote the health and prevent the diseases also. The next one, school health nurse, and the next one, military nurse and higher studies. If you are getting the diploma, oh, this is very important point of to take a GNM. If you are not if you're not having any idea after plus 2 means, definitely you can go through this particular diploma course means, definitely you will get a opportunity to do a graduation in this particular sector also. So that is what BSc nursing. So you can after completion of this one, you can go through the post basic. Okay, that one, the post basic course crash course will be on tomorrow, so that also you can watch at the same time in our channel. The next, military nurse. That military nurse means you can work in the defense sector also. As a nurse, you can provide a care and promote the health of the soldier. And as well as school health nurse, you can work in the school health sector. You can provide a care for the children who are present in the particular school. Okay, this is all about the course overview of the GNM, General Nursing Midwifery. Now we can move towards the subject overview. Before going to start the subject overview, here the same thing we have given the regarding this particular 3-year diploma course, and what it will be there here, the midwifery designed to provide a holistic foundation in nursing, as well as you get a diverse skill in various areas like clinical nursing, midwifery, community health, that already I have explained. And next, we can see the updated curriculum. This is all about the curriculum has been rendered by the Indian Nursing Council according to revised in the program 2015 and integrated internship within a 3 years period for enhanced practical exposure. You will get the integrated internship for practical skills to enhance your practical skills. So after that, you can be out from the university or from your college to the world as a skilled nurse. Okay, now we can see the subject review. So please concentrate here. I will explain both in Kannada and English language. So, when it comes to the subject review, very first I'll go with the first year. Okay, year wise subject review we are going to provide for you. So here what it will be happen the first time in the first year GNM first year we have around 5 subjects. Okay, so in that also it is going to be divide deeply. I will explain you. You can see here first one is bioscience. Bioscience means it is a behavioral science, bioscience. And the next one is bioscience means it is a living science. The next one is behavioral science. The next one is nursing foundation and community health nursing, language and technology. Okay, so this is what your curriculum has been planned to guide you or give a study material on the basis of this content. Okay, so in the first year you are going to study this one only. ಯಾರೆಲ್ಲ ಫಸ್ಟ್ ಇಯರ್ ಜಿ ಎನ್ ಎಂ ಓದ್ತಾ ಇದ್ದೀರಾ, ಸೊ ಅವ್ರಿಗೆ ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ರಿವ್ಯೂ ಏನಪ್ಪಾ ಅಂತ ಹೇಳಿದ್ರೆ ನೀವು ಓದ್ಬೇಕಾಗಿರೋದು ಮೇಜರ್ ಆಗಿ 5 ಸಬ್ಜೆಕ್ಟ್ಸ್ ಅದರಲ್ಲಿ ಡಿವೈಡ್ ಆಗಿದೆ. ಅದನ್ನ ನಾನು ಡೀಟೇಲ್ ಆಗಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೀನಿ. ಸೊ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಫಸ್ಟ್ ಅಂತ ಹೇಳಿದ್ರೆ ಬಯೋಸೈನ್ಸ್ ಅಂತ ಹೇಳಿದ್ರೆ ನಿಮಗೆ ಗೊತ್ತಿರೋ ಹಾಗೆ ಅದು ಲಿವಿಂಗ್ ಸೈನ್ಸ್. ಓಕೆನಾ, so living science adalmele behavioral science. You are going to study about the behavior of a person or a human being. The next one, nursing foundation, it is a foundation subject for all nurses. ಅದಾದ್ಮೇಲೆ ನೀವು ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಓದ್ಬೇಕಾಗುತ್ತೆ. ಅದಾದ್ಮೇಲೆ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಂಡ್ ಟೆಕ್ನಾಲಜಿ. ನಾನು ಇವಾಗ ಒಂದನ್ನೇ ಡೀಪ್ ಆಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡ್ಕೊಂಡು ಹೋಗ್ತೀನಿ. ಸೊ both of the language will be convenient for you guys. And so when it comes to the bioscience anta helidre, first one ಬಂದ್ಬಿಟ್ಟು anatomy and physiology. So anatomy and physiology, see ಇಲ್ಲಿ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗಿರೋದು ತುಂಬಾ ಇದೆ. Anatomy and physiology, you are coming from the various streams, right? So here it will may be difficulty for you. So for that I will give you some tips. Okay, so based on the experience, you should practice every day. Once you started your course, you have to practice every day the anatomical terms, positions, everything. Okay, the functions of each and every body, the organs. So when it comes to practice, so if you are practicing every day, definitely it will make you to help to get a good marks in your examination. If you are studying at last of the examination, okay, ಯುದ್ಧಕಾಲೆ ಶಸ್ತ್ರಾಭ್ಯಾಸ ಅಂತ ಹೇಳಿದ್ರೆ ನಿಜವಾಗ್ಲೂ ಅನಾಟಮಿ ಅಂಡ್ ಫಿಸಿಯಾಲಜಿ ನಿಮ್ಗೆ ಓದೋದಕ್ಕೆ ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗುತ್ತೆ. ಓದಕ್ಕಾಗಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ಇನಿಷಿಯಲಿ ಯು ಹ್ಯಾವ್ ಟು ಸ್ಟಾರ್ಟ್ ದಿಸ್ ಒನ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಒನ್ ಬಂದ್ಬಿಟ್ಟು ಮೈಕ್ರೋಬಯಾಲಜಿ. ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ದ ಮೈಕ್ರೋಬಯಾಲಜಿ, ಇಟ್ ಇಸ್ ಅ ಸ್ಟಡಿ ಆಫ್ ಮೈಕ್ರೋ ಆರ್ಗ್ಯಾನಿಸಮ್ಸ್ ವಿಚ್ ವಿ ಕಾಂಟ್ ಏಬಲ್ ಟು ಸಿ ಇನ್ ಅವರ್ ನೇಕೆಡ್ ಐಸ್. ಓಕೆ, ಸೂಕ್ಷ್ಮಾಣು ಜೀವಿಗಳ ಬಗ್ಗೆ ನಾವು ತಿಳ್ಕೊಳ್ತಾ ಹೋಗೋದನ್ನ ಮೈಕ್ರೋಬಯಾಲಜಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಅದರಲ್ಲಿ ಮೇನ್ ಆಗಿ ನಾನು ಅನಾಟಮಿ ಫಿಸಿಯಾಲಜಿಲಿ ಏನು ಓದ್ತೀವಿ ಅಂತ ಹೇಳಿಲ್ಲ. ಅನಾಟಮಿಲಿ ನಾವು ಸ್ಟ್ರಕ್ಚರ್ ಆಫ್ ಆರ್ಗನ್ಸ್ ಓದ್ತೀವಿ. ಫಿಸಿಯಾಲಜಿಲಿ ನಾವು ಫಂಕ್ಷನ್ಸ್ ಆಫ್ ದ ಆರ್ಗನ್ಸ್ ಇನ್ ದ ಹ್ಯೂಮನ್ ಬಾಡಿ ಅಂಡ್ ಬಾಡಿ ಫಂಕ್ಷನ್ಸ್ ನ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. ಸೊ ಅನಾಟಮಿ ಅಂತ ಹೇಳಿದ್ರೆ ರಚನೆ, ಅದು ಹೇಗಿದೆ. ಓಕೆ, ಸೊ ಒಂದು ಆರ್ಗನ್ ಹೇಗಿದೆ, ಅದರ ರಚನೆ ಹೇಗಿದೆ, ಅದರ ಶೇಪ್ ಯಾವ ತರ ಇದೆ ಅಂತ ಓದೋದೆ ಅನಾಟಮಿ. ಅದನ್ನ ಡೀಪ್ ಆಗಿ ಓದ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಇಟ್ ಇಸ್ ಅ ಸಬ್ಜೆಕ್ಟ್, ಇಟ್ ಇಸ್ ಬೇಸ್ಡ್ ಫಾರ್ ಯು ಗೈಸ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಒನ್ ಬಂದ್ಬಿಟ್ಟು ಬಿಹೇವಿಯರ್ ಸೈನ್ಸ್. ಇದ್ರಲ್ಲೂ ಕೂಡ ಎರಡು ಸಬ್ಜೆಕ್ಟ್ಸ್ ಬರುತ್ತೆ. ದ ಫಸ್ಟ್ ಒನ್ ಬಂದ್ಬಿಟ್ಟು ಸೈಕಾಲಜಿ ಅಂಡ್ ದ ನೆಕ್ಸ್ಟ್ ಒನ್ ಬಂದ್ಬಿಟ್ಟು ಸೋಷಿಯಾಲಜಿ. ಸೈಕಾಲಜಿ ಇಲ್ಲಿ ನೀವು ನೋಡ್ತಿರೋ ಹಾಗೆ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಹ್ಯೂಮನ್ ಮೈಂಡ್ ಅಂಡ್ ಬಿಹೇವಿಯರ್ ನ ನಾವು ಸೈಕಾಲಜಿಲಿ ಓದ್ತೀವಿ. ಸೈಕಾಲಜಿ ಮೀನ್ಸ್ ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಸ್ಟಡಿ ಅಬೌಟ್ ದ ಹ್ಯೂಮನ್ ಬಿಹೇವಿಯರ್. ಸೋಷಿಯಾಲಜಿ ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಸ್ಟಡಿ ಅಬೌಟ್ ದ ಸೋಷಿಯಲ್ ಸ್ಟ್ರಕ್ಚರ್ ಅಂಡ್ ಇಟ್ಸ್ ಹೆಲ್ತ್ ಇಂಪ್ಯಾಕ್ಟ್ ಆನ್ ದ society. Okay, we are going to study about the society. That is what ಸೋಷಿಯಾಲಜಿ. ಓಕೆ, ಇಷ್ಟು ಈ ಎರಡು ಸಬ್ಜೆಕ್ಟ್ ನ ಓದ್ತೀವಿ. ಇದರಲ್ಲಿ ಸೋಷಿಯಾಲಜಿಲಿ ಕಲ್ಚರ್ ಅಂದ್ರೆ ಏನು, ಲೇಟರ್ ಐ ವಿಲ್ ಎಕ್ಸ್ಪ್ಲೈನ್ ಯು. ಓಕೆ, ಫ್ಯಾಮಿಲಿ ಅಂದ್ರೆ ಏನು, ಎಲ್ಲಾನು ಡೀಪ್ ಆಗಿ ತಿಳ್ಕೊಳ್ತಾ ಹೋಗ್ತೀವಿ. ಓಕೆ, ಸೊ ದ ನೆಕ್ಸ್ಟ್ ಒನ್ ನರ್ಸಿಂಗ್ ಫೌಂಡೇಶನ್. ದಿಸ್ ಇಸ್ ಅ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಸಬ್ಜೆಕ್ಟ್. ವೆರಿ ಫಸ್ಟ್ ನೀವು ಏನ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳಿದ್ರೆ, ನೀವು ಯಾವಾಗ್ಲೂ ಓದ್ತಿರುವಾಗ ನರ್ಸಿಂಗ್ ಫೌಂಡೇಶನ್ ಸಬ್ಜೆಕ್ಟ್ ನ, ಸೊ ಕೀಪ್ ಒನ್ ಎಕ್ಸ್ಟ್ರಾ ಬುಕ್. Okay, here in this particular foundation subject, we are going to study all the procedures. Especially, we are going to study from scratch to advanced level. Okay, so for that reason, my advice is that keep one small short notes for making all the procedure in one book. Okay, make sure if you are doing like this means it will definitely one day means if you are leaving your course also means if you finish your course also you it will be very helpful to you. So what it will be happen at the time of your career also it make you to help better. Okay. The next one is community health nurse. So, sorry, here only you are going to include the first aid model also. Okay. So, in the nursing foundation only, you are going to study about this first aid model means emergency procedures and protocols, whatever it will be there. And that will make you to get advanced knowledge to work skillfully in the emergency situations. Okay. So, this is the subjects you are going to cover in the fundamentals means the major topics you are going to study in this particular topic. The next one is community health nurse. When it comes to the community health nurse, the promotion and disease prevention, definitely it is we are going to study about this disease prevention and promotion of the health through the health education. Okay, that is what we are going to do in the community health sector. Very knowingly we should work in the community means we are very near to means act as a frontline worker to the people and the society. So what we need to do, we have to promote the health, and as well as we are our motto is to prevent the diseases. The next one is environmental hygiene. When it comes to the environmental hygiene, our environment makes a major part to promote a good health, so we have to take care of our environment, so as well as the community environment. The next one is health education and communication, which will tells you how to educate the people and how to communicate with the people and the public. The last one under this community health nursing, first you are going to study about the nutrition. So hope you guys are understood the community health nursing, and make sure one more important things I need to tell you. So the community nursing health nursing part, first only you are going to study in the first year GNM. Okay, the last one is language and technology. When it comes to the language and technology, it is every subject which will be in the language of English. So you must and should know English. Okay, at least manageable English you should know to understand the topics better. No one will come and teach you in your own languages. Okay, in the colleges. Okay, you can study you through YouTube. In our channel we are going to provide a various language lecturers, but if you are studying in college means everybody will come and teach you in the English only. So for that reason you have to well versed in this English language. You are going to study grammar, writing, listening, speaking and reading. Okay, like this four modules will be there, so that you are going to study. And the next one is computer education. So for this computer education, in the hospital sector you are going to work means you should have a basic knowledge of the computer like MS Office, internet basics and IT skills are important. So that kind of major topics you're going to learn in the computer educations. Okay, so when it comes to this, there is no examination apart from this knowledge, language and technology. There is no exam. Okay, so for this english and english and computer education there is no exam. Apart from this, all the subjects have the exam. Okay, next we can move the first subject, that is what bioscience, anatomy and physiology. Here you are going to study about the anatomical terms of the body in the first unit. Total we have 14 units, don't be confused. Total we have 14 units. In the first unit you are going to study, as I told you before only, you are going to study the terminologies of the anatomy and as well as body system and the cavities. Okay, so those are the basic things you are going to study in the first unit. Second unit you are going to study about the cells, types of the cells, tissues, and the glands. This third unit is blood. We are going to study about the blood composition, function, and clotting and bleeding factors. The next one, circulatory system. In the circulatory system, mainly we are going to study about the heart, vessels, and blood pressure. PP means blood pressure. See, here when it comes to the circulatory system, someone will ask you which uh, organ you are going to study. Means mainly you are going to study about the heart and vessels and blood pressure. Okay, so don't be confused with the CVA and this one. Okay, CVA, so the cardiovascular system is also there and circulatory system is also there. Both you are going to study about the heart only. Okay, the next one is lymphatic system. When it comes to the lymphatic system, here we are going to study about the lymph nodes and as well as the spleen, thymus, and the circulation of the white blood cells. Okay, in our body. The next one, respiratory system. Respiratory means, of course, we know that we are going to study about the organs, respiration process. Okay, respiration, expiration, and inspiration, everything we are going to study. The organs means we are going to study about the lungs. Okay, deeply we are going to study about the structure and functions of the lungs. The next one, digestive system. You know, digestive system means we are going to study about the GI tract, digestion and metabolism from mouth to till rectum. We are going to study in this particular system. The next one is excretory system. Here we are going to study about the kidney, urine formation, and skin and temperature. Okay. The next one, endocrine system. Here we are going to study about the glands. Okay, endocrine glands, we are going to study thyroid gland, then for example parathyroid gland, and then adrenal gland, pituitary gland, posterior, anterior, whatever the things which will be related for the endocrine glands, that we are going to study related to the hormones. We are going to study in this particular endocrine system. Next, we can move towards the reproductive system. Both the male and female reproductive system we are going to study under this particular reproductive system. The next one, the nervous system. Here we are going to study about our brain. And next one, sensory organs. The 12th unit is sensory organs. We are going to study about the sensory organs. The skeletal system, that is we are going to study about the bones, and as well as we are going to study about the muscular system, which is related to muscle in the 14th unit. One second. The next syllabus review of the second subject in the bioscience, that is what, microbiology. In the microbiology, the first unit we are going to study about the introduction. Second unit, microorganisms. The third unit, infection and transmission and its transmission. When it comes to the second unit, we are going to study about the bacteria, virus, fungus, various microorganisms. The next one, infection and its transmission. We are going to study about the infection. Okay. The next one, immunity. The types of immunity, active immunity, passive immunity, everything you are going to study here. Then control and destruction of the microbes, that is what infection control, the sterilization, disinfection, methods of sterilization, everything we are going to study here. And the next one, practical microbiology. How to you are working in microbiology sector means how you have to know how to handle the microscope, other things you are going to detailedly study in the practical microbiology. So this is all about the microbiology subject. Here you have a six important units. Next, we can see the behavioral science. In the behavioral science, in psychology, we have around 6 units, and sociology, we have around 5 units. Here you can see first itself, in every subject, they used to tell about the subject in the first unit itself. That is what? The introduction. Here you can see the definition, branches, scope of psychology, everything. And the next one, structure of mind. The second one, here you can able to learn regarding this the conscious, subconscious, and unconscious mind, and the psychology of a human behavior. The third unit, here it is one of the biggest unit in your psychology subject, and it has lots of things inside the unit: emotions, motivation, attitude, and the theory of motivations. Okay, Maslow's hierarchy theory, and as well as psychological needs, social needs, and as well as you are going to study about conflicts, frustration, everything. Okay, the next one, fourth unit, that is very important. Third unit, don't skip to study. Start to study by today itself. The next one, we are going to study about learning. When it comes to the learning, we are going to study about the types and its process of learning, how the learning will takes place. Okay, their process we are going to study. And the next one is personality. Here we are going to study about the development of the personality traits, influencing factors to good personality, bad personality, the differentiation, everything we are going to study in this particular personality chapter. Okay, the next one, intelligence. This is also one of the important, and for sure from this unit, 2 marks questions will come. So when it comes to intelligence, so we are going to see about this definition, types, and assessment. When it comes to the assessment, we are going to calculate the IQ, intelligent quotient. Okay, this is very important. There is a formula for find out the IQ, so that is also very important as point of your examination. So please study that too. The next one, so this is all about the psychology. Okay, so total we have a 6 units. The next one is sociology. Okay, the sociology means the society and the health they have given, and so here also we have a 5 units. Idrili 5 units only we have to study around every unit, and especially the family will plays a major role when it's come to your part of a study. So it is one of the very big unit, and here you can see in the introduction you are going to know about all the things which is related to the particular subject. Okay, which means sociology. The next one is individual. Okay, in the individual you are going to study about the human is a social being, so you are going to study about the one human. Okay, the next one is how the characteristics will be there, everything you are going to study in the second unit. The third unit will be family. Here you are going to study about the types of family, joint family, nuclear family. Okay, so lots of family classification will become, so that okay, so when it comes to the family, use a tip while writing the examination, use a schematic representation, which means once you are writing for a types and all, use some tables. Okay, so flowcharts you can use, means definitely it will looks better and you will get a good marks also. The next one, for remembrance also it will be easy to remember if you're writing like that. The next one, society. When it comes to the society, you're going to study about the social groups, norms and values. The last one, the community. You are going to study about the urban community and the rural health community support systems and all, it will be there. Okay, this is all about the psychology and sociology. Next we can move towards the nursing foundation. When it comes to the nursing foundation, here also the first unit will be introduction, and the second unit you are going to study about the, when it comes to the first unit, so you are going to study about the definitions, history, ethics, and roles of the nurse. Okay, this is very basic, and if this unit will help you throughout your journey till your last, it is going to be help. Okay, the next one is nursing care of the patient. When it comes to the nursing care of the patient, how you have to provide a general care, how you are going to communicate with the patient, and about the dignity and all, you are going to study in the second unit. The next one is meeting and basic needs. Okay, it is all about the basic needs, what you are going to provide for the patient, especially nutrition, hygiene, mobility, elimination, comfort. The next one, assessment of the patient or the client. See, here you are going to take the assessment, initial step. Okay, the nursing process will be there. In that particular, we are going to do the assessment. So, how to collect the data, history, and how to observe the patient, charting, everything you are going to study in this particular fourth unit. This is very important, so you have to thoroughly study this one too. Then next one is infection control. When it comes to the infection control, medical and surgical asepsis, there is a method will be there, that sterilization, disinfection, all the things you are going to study. Okay, and along with that, isolation techniques also you are going to study in this particular unit. The next one, fifth one. Fifth one is infection control. The fifth one is over. The sixth one, therapeutic nursing care. When it comes to the therapeutic nursing care, techniques and procedures for recovery. Okay, so this is all you are going to study. And here we can see the seventh unit. Um, Introduction to clinical pharmacology regarding the drugs and action side effects of the particular drugs. You're going to study this one also very important. Per day, one drug is very important. Write it down in a small book and try to recall it every day. Okay, one drug. If you are taking drug should be there. The name of the drug, brand of the drug, and you have to see the generic name of the drug and dosage, route, as well as you're going with this type of drug actions and indications, contraindications also you can write and side effects also. So this much you can write. The next one is first aid and emergency care. When it comes to the first aid and emergency care, introduction. First is introduction, and the second one is procedure and techniques. The third one is first aid in the emergency. When it comes to the emergency, burns, fracture, bleeding, shock, poisoning, what is your action towards the particular emergency situation? That is what you are going to study. And the last one is community emergencies like disaster response, fire safety, community resources, and referrals. Okay, so these are all the things you are going to study in the first aid emergency care. So totally from nursing foundation we have around 7 units, and from first aid you are going to study about 4 units. So this is the basic. Study thoroughly this subject. The next, the last subject of the first year is community health nursing first. When it comes to the community health nursing first, we have around 9 subjects. The first one is introduction. You are going to know about the community, and the second one is community health nursing. As I already told you, the community health nursing first only we are going to study part one. Okay, part second also will be there. That will be you are going to study in the next years, upcoming years. That I will tell you. ಸೊ ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಕನ್ಫ್ಯೂಸ್ ಆಗೋದು ಬೇಡ. ಫಸ್ಟ್ ಇಯರ್ ಅಲ್ಲಿ ಫಸ್ಟ್ ಪಾರ್ಟ್ ನ ಮಾತ್ರ ಓದ್ತೀವಿ. ಅದರಲ್ಲಿ ಇಂಟ್ರೊಡಕ್ಷನ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ಪರ್ಟಿಕ್ಯುಲರ್ ಸಬ್ಜೆಕ್ಟ್ ಇರುತ್ತೆ. ಸೆಕೆಂಡ್ ಒನ್ ಬಂದು ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್. ಅದರಲ್ಲಿ ಹೋಮ್ ವಿಸಿಟ್ ಹೇಗೆ ಮಾಡಬೇಕು, ಹೆಲ್ತ್ ಟೀಚಿಂಗ್ ವಿಚ್ ಮೀನ್ಸ್ ಹೆಲ್ತ್ ಎಜುಕೇಶನ್ ಹೇಗೆ ಕೊಡಬೇಕು, ಪ್ರಮೋಷನ್ ಹೆಲ್ತ್ ಪ್ರಮೋಷನ್ ಹೇಗೆ ಮಾಡಬೇಕು ಅಂತ ಇರುತ್ತೆ. The next one ಬಂದು health assessment. When it comes to the health assessment, you have to assess antenatal mothers will be there, postnatal mothers will be there, and adults will be there, geriatric patients will be there in the community. So family survey ಮಾಡೋದಿರುತ್ತೆ, vital signs, nutritional status of the adolescents and under 5 year children. Lots of things will be there to assess in the community. So for each and everybody, according to their age group, there will be a certain criteria. Okay, so that you have to focus, that you have to learn thoroughly, and you have to go for a community posting. If you go for a community posting, you will get the knowledge regarding this. Definitely, if you study this particular unit, there you can work skillfully. Okay, the next one is family health nursing care. That is also including the, sorry, fourth unit is epidemiology. Here you are going to see the disease patterns and prevention strategies. When it comes to the epidemiology, you are going to see how the disease will come, which is the host. Okay, all those things you are going to study in the epidemiology. And the reason of the disease and all you are going to study here. And here you're going to study about the epidemiological triad will be there, and how to prevent. Okay, how to prevent the particular diseases in community means lots of disease conditions will be there, right? Communicable disease, non-communicable disease. So for those things we have to find out the strategies. Those strategies are going to be studied under the fourth unit. That is what epidemiology. The next one is fifth unit, family health nursing care. Here you are going to study about the maternal, which is related to mothers and child, and elderly, the geriatric care. The sixth unit, family health settings, home visit, procedures, planning, documentation will be there here. Okay, the next one, referral system, when and how to refer from PHC to CHC. So from lower authority to higher authority. So all those things. Okay, so district hospital will be there. All the criteria you are going to study how to refer, how the referral system will work in the community. That's what you are going to study. Okay, the next one, minor elements, the management of the community level. If it is minor elements like any small situations like the deliveries or the antenatal care will be there, how you need to handle, how you need to manage those things, you are at community level. Okay, there itself what kind of care you can give. That is what you are going to study in this minor elements. Okay. The next one is environmental hygiene. Here in this particular subject only, the section A you are going to study about the community health nursing part first, means section B you are going to study, here you can see here environmental hygiene. Here the introduction regarding the environmental hygiene, basically you are going to study about the water air in the second unit waste, one second, uh, waste management, housing, sanitation, all those things, and community organization, the government and NGOs roles in the environmental health and all you are going to study in this particular 3 units. Okay, these 3 units also very important as point of your examination. The next one is here in this particular community health nursing, under this only the major topic is health education and communication. Here you are going to study about the first unit, the communication skills. Second one is health education and counseling, third unit. And the last is methods and media. So how you need to promote the health by using the methods. That is what the fourth unit. Okay. So how you need to talk, verbal and non-verbal communications. What are the barriers between the verbal and non-verbal communications? How you need to improve the skills of the communication. Everything you are going to study in the first unit. ಸೆಕೆಂಡ್ ಯೂನಿಟ್ ಹೆಲ್ತ್ ಎಜುಕೇಶನ್. ಸಿ ನಾವು ಯಾರಿಗೂ ಹೋಗ್ಬಿಟ್ಟು ಸುಮ್ಮನೆ ಏನೋ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಹೆಲ್ತ್ ಎಜುಕೇಶನ್ ಅಂದ್ರೆ ಅದಕ್ಕೆ ಒಂದು ಪ್ರಾಪರ್ ಫಾರ್ಮೇಶನ್ಸ್ ಆಫ್ ಸ್ಟ್ರಕ್ಚರ್ಸ್ ಇರುತ್ತೆ. ಸೊ ಫಸ್ಟ್ ನಾವು ಯಾವ್ದ್ರ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕು, ಒಂದು ರೋಗಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದ್ರೆ ಹೇಗೆ ಹೇಳ್ಬೇಕು, ಅಥವಾ ಕಮ್ಯುನಿಟಿ ಸೆಕ್ಟರ್ ಅಲ್ಲಿ ನಾವು ಹೆಲ್ತ್ ಎಜುಕೇಶನ್ ಯಾವ ರೀತಿ ಕೊಡಬೇಕು, ಅದರದೇ ಆದಂತಹ ಗೈಡ್ಲೈನ್ಸ್ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನ ಕೂಡ ನಾವು ಇಲ್ಲಿ ಕಲಿತಾ ಹೋಗ್ತೀವಿ ಸೆಕೆಂಡ್ ಯೂನಿಟ್ ಅಲ್ಲಿ. ನೆಕ್ಸ್ಟ್ ಒನ್ ಬಂದ್ಬಿಟ್ಟು ಕೌನ್ಸಿಲಿಂಗ್. ಯು ಆರ್ ಗೋಯಿಂಗ್ ಟು ಲರ್ನ್ ಅಬೌಟ್ ದ ಟೈಪ್ಸ್ ಆಫ್ ಕೌನ್ಸಿಲಿಂಗ್ ಅಂಡ್ ವಾಟ್ ಆರ್ ದ ಟೆಕ್ನಿಕ್ಸ್ ವಿ ಕ್ಯಾನ್ ಯೂಸ್ in the particular counseling, and as well as we are going to study about the applications in the nursing. Okay, the next one, methods and media. Already I told how we are going to promote the health means do using this poster charts, audio visual aids ಅಥವಾ ರೋಲ್ ಪ್ಲೇ ಮಾಡೋದು. ನರ್ಸಿಂಗ್ ವಿದ್ಯಾರ್ಥಿಗಳು ಮಾಡ್ತಾ ಇರ್ತಾರಲ್ವಾ, ಕಮ್ಯುನಿಟಿ ಸೆಕ್ಟರ್ಗೆ ಹೋಗ್ಬಿಟ್ಟು ಒಂದೊಂದು ರೋಲ್ ಪ್ಲೇ ಮಾಡಿಬಿಟ್ಟು ಅಥವಾ ಟ್ಯೂಬರ್ಕ್ಯುಲೋಸಿಸ್ ಬಗ್ಗೆನೋ HIV ಬಗ್ಗೆನೋ ಯಾವ್ದ್ರ ಬಗ್ಗೆನೋ ಒಂದು ಅರಿವು ಮೂಡಿಸೋ ಕಾರ್ಯ ಮಾಡ್ತಾ ಇರ್ತಾರಲ್ವಾ. ಸೊ ದಟ್ ಇಸ್ ವಾಟ್ ದ ರೋಲ್ ಪ್ಲೇ. ಈ ತರದನ್ನ ಹೇಗ್ ಮಾಡಬೇಕು, ಏನೆಲ್ಲ ಅಂಶಗಳನ್ನ ರೋಲ್ ಪ್ಲೇ ಹೊಂದಿರಬೇಕು, ಆ ಪೋಸ್ಟರ್ಸ್ ಅಂದ್ರೆ ಅದು ಹೇಗಿರ್ಬೇಕು, ಅದ್ರ ಸೈಜ್ ಏನು, ಪ್ರತಿಯೊಂದನ್ನ ಕಲಿಯೋದು ಈ ಮೆಥಡ್ಸ್ ಅಂಡ್ ಮೀಡಿಯಾದು. ನೆಕ್ಸ್ಟ್ ಒನ್ ಬಂದು ಇಂಗ್ಲಿಷ್ ಅಂಡ್ ಕಂಪ್ಯೂಟರ್ ಎಜುಕೇಶನ್. ಇದರಲ್ಲಿ ನಾವು ಗ್ರಾಮರ್, ಕಾಂಪೋಸಿಷನ್ ಅಂಡ್ ಸ್ಪೋಕನ್ ಇಂಗ್ಲಿಷ್ ಬಗ್ಗೆ ಕಲ್ತ್ಕೊಳ್ತಾ ಹೋಗ್ತೀವಿ. ದ ನೆಕ್ಸ್ಟ್ ಒನ್ ಕಂಪ್ಯೂಟರ್ ಎಜುಕೇಶನ್ ಅಲ್ಲಿ ಇಂಟ್ರೊಡಕ್ಷನ್ ಟು ಕಂಪ್ಯೂಟರ್, MS ಆಫೀಸ್, ದೆನ್ ಮಲ್ಟಿಮೀಡಿಯಾ, ಇಂಟರ್ನೆಟ್, ಇಮೇಲ್ ಕಮ್ಯುನಿಕೇಶನ್, ರಿಸರ್ಚ್ ಅಂಡ್ ರೆಕಾರ್ಡ್ ಕೀಪಿಂಗ್ ಹೇಗೆ ಮಾಡೋದು ಅಂತ ಇಷ್ಟನ್ನ ಕಲಿತೀವಿ. ಇದರಿಂದ ಏನು ಎಕ್ಸಾಮ್ ಬರಲ್ಲ. ಬಿಫೋರ್ ಇಂಗ್ಲಿಷ್ ಮತ್ತೆ ಕಮ್ಯುನಿಕೇಶನ್ ಬಿಟ್ಟು ಎಲ್ಲ ಏನ್ ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ ಅದರಿಂದ ಎಕ್ಸಾಮಿನೇಷನ್ ಪಕ್ಕಾ ಬರುತ್ತೆ. ಸೊ ದೋಸ್ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಆಫ್ examination, board level examination. And ಇದು ಒಂದು ಕಮ್ಯುನಿಟಿಲೇ ಬರೋದು ನ್ಯೂಟ್ರಿಷನ್, ಸ್ವಲ್ಪ ಇಂಟರ್ಚೇಂಜ್ ಆಗಿದೆ ಇಲ್ಲಿ. So here what it will be happen, this subject also which will be included in the community. So that is what why nutrition is very important to study as a nurse. So you have to provide a guidance to the patient what kind of nutrition diet they should follow when they are sick. So that is what, and what is the role of the food in health. Okay, so food will be the medicine and medicine will be the food. Okay, you know that. So that is why we have the food plays a major role in the health. So introduction ಅಲ್ಲಿ ಅದನ್ನ ಓದ್ತೀವಿ. The next one ಬಂದು classification of the food. There we are going to study about the macronutrients and the micronutrients, vitamins, minerals ಬಗ್ಗೆ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. The next one, normal dietary requirements based on the age, activity, health status. For example, antenatal diet will be changed, postnatal diet will be changed, children under 5 year diet will be changed, diabetic patient diet will be changed, geriatric diet will be changed. So all those things you have to focus and you are going to differentiate and learn in this particular dietary requirements. Okay, the next one, food preparation, preservation, storage, safe cooking and hygiene methods you are going to study in the fourth unit. Then therapeutic diets for diabetes and hypertension and obesity. These are the treatment diets. Okay, for they are taking for diets for diabetes, hypertension and obesity, that will make you to curb the things. Okay, so if they are taking the diet which is related to diabetes, means they can decrease the level of sugar, glucose in their body. Okay, so that is what the therapeutic diets. Okay, by providing the diet, they can treat their diseases or disorders. The next one is community nutrition. Here, addressing the malnutrition and food security. When it comes to this one, malnutrition and food security matters a lot, because especially in the under 5 children's, people, the children's will, most of the things they are not getting a sufficient amount of good food. Rich food means what it will be happen, they are going to suffer with the malnutrition. Okay, the lack of nutrition will be happen. Malnutrition ಅಂತ ಹೇಳಿದ್ರೆ lack of nutrition ಆಗುತ್ತೆ. And food security ಬಗ್ಗೆ ಕೂಡ ಈ ಯೂನಿಟ್ ಅಲ್ಲಿ ಓದ್ತಾ ಹೋಗ್ತೀರಾ. ಪ್ರಾಕ್ಟಿಕಲ್ ಡಯಟ್ ಅಂಡ್ ಪ್ರಿಪರೇಷನ್. ಓಕೆ, ಇದು ಬ್ಯಾಲೆನ್ಸ್ಡ್ ಮೀಲ್ ಪ್ಲಾನ್ ಹೇಗೆ ಮಾಡೋದು ಮತ್ತೆ ಅದ್ರ ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಹೇಗೆ ಮಾಡೋದು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಈ 7th ಯೂನಿಟ್ ಅಲ್ಲಿ ಕಲಿತೀರಾ. ಕನ್ಫ್ಯೂಸ್ ಆಗಬೇಡಿ. ಈ ನ್ಯೂಟ್ರಿಷನ್ ಅನ್ನೋ ಟಾಪಿಕ್ ಕೂಡ ಬರೋದು ಹೆಲ್ತ್ ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಫಸ್ಟ್ ಪಾರ್ಟ್ ಅಲ್ಲಿ. ಓಕೆ, ಅದಾದ್ಮೇಲೆ ಯಾವ್ದು ಬರುತ್ತೆ, ಇದು ಇಂಗ್ಲಿಷ್ ಮತ್ತೆ ಟೆಕ್ನಾಲಜಿ. ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಇಂಗ್ಲಿಷ್ ಮತ್ತೆ ಟೆಕ್ನಾಲಜಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಅದಕ್ಕೆ ಎಕ್ಸಾಮಿನೇಷನ್ ಇರಲ್ಲ. ಕಾಲೇಜ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಮಾಡ್ತಾರೆ, ಬೋರ್ಡ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಎಕ್ಸಾಮಿನೇಷನ್ ಇರಲ್ಲ. ಸೊ ಇವಾಗ ನೋಡೋಣ, ಇಲ್ಲಿ ಬಂದು ನಾವು ನೋಡ್ತಾ ಇರೋದು ಎಕ್ಸಾಮಿನೇಷನ್ ಪ್ಯಾಟರ್ನ್. ಇಷ್ಟ್ರ ಬಗ್ಗೆ ಸಿಲೆಬಸ್ ಏನು, ಸಬ್ಜೆಕ್ಟ್ಸ್ ಏನು ಅಂತ ತಿಳ್ಕೊಂಡ್ವಿ ಡೀಪ್ ಆಗಿ. ಇವಾಗ ನಾವು ನೋಡ್ತಾ ಇರೋದು ಕ್ವೆಶನ್ ಪೇಪರ್ ಪ್ಯಾಟರ್ನ್ ಹೇಗಿರುತ್ತೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಇಲ್ಲಿ ನಾನು ಡೀಪ್ ಆಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಲ್ಲ, ಕ್ವೆಶನ್ ಪೇಪರ್ ಪ್ಯಾಟರ್ನ್ ಮಾತ್ರ ಹೇಳ್ತೀನಿ. ಓಕೆ, ಐ ಆಮ್ ಗೋನಾ ಟೆಲ್ ಯು ರಿಗಾರ್ಡಿಂಗ್ ದ ಕ್ವೆಶನ್ ಪೇಪರ್ ಪ್ಯಾಟರ್ನ್. So your examination is going to be conduct for a 75 marks. Okay, the total marks is 75. The duration is 3 hours, and the time will be, of course, from most of the time it will be morning. So 9 a.m. to 12 p.m. it will be there. It will going to schedule. So when it comes to this one, you are going to have a 4 meaning of the following. Okay, each question carries 1 marks. Each question carries 1 marks. The second main, you are going to see that the second one, you are going to see that the fill in the blanks, that is what 4 questions will be there. Each question carries 1 mark. The next one, here you can see, write the short notes. Write a short notes for any 4 of the following. Here they will give a 5, but you have to choose only 4. Okay, so 4 into 4, each question carries 4 marks. Here you can score 16 marks. And then the last one is, the next one is answer the following. Here also you have 4 questions. In that 3 plus 4 is equal to 7. Okay, here you are going to, for 3 questions you are going to carry 7 marks, and 1 question carries 3 plus 5, that is what 8 marks. Okay, that is how it will be designed. For a total you are going to score here 7 plus 8, 15 marks you are going to score in this particular main. Okay, the next one is a true or false. Here also you have to write only true or false. The statement is correct or not. Okay, the true or false, that is what you are going to write. That is for 4 marks, and each question carries 1 mark, and total questions are 4. The next one, here we have write a short notes for any 4 of the following. Here you can see that 5 questions will be there. You have to answer for only 4 questions. Each question carries 4 marks. Again, you have to get 16 marks of total marks. And the next one, answer the following. Here also 4 questions will be there. So one question will, first 2 will carry 3 plus 5, that is equals to 8. Then second 2 will carry 4 plus 4, which means 8. So in this particular main also you are going to carry 16 marks. Okay, so 8 plus 8, 16. So this is how you are going to write for the 75 marks. My tip of examination is that you should not leave any kind of questions. Okay, so that is what one paper we have seen. Today we have seen this bioscience. When it comes to the bioscience, one more thing I will tell you. See here, you can see here. Okay, you can see one paper only, all three particular subjects will come. Don't confuse with this particular paper. Okay, from anatomy, physiology, and microbiology, including, you are going to get 75 marks. Okay. So this is all about the pattern of the examination. Now we can see the second year. So before going to start the second year, for first year students, I will go to give some examination tips. ನೀವು ಎಕ್ಸಾಮ್ ಬರೆಯುವಾಗ ಯಾವಾಗಲೂ ಸ್ಕೀಮ್ಯಾಟಿಕ್ ರಿಪ್ರೆಸೆಂಟೇಷನ್ ಮೇಂಟೈನ್ ಮಾಡಿ, ಅಂಡ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಯಾವುದೇ ಒಂದು ಎಕ್ಸಾಮ್ ಬರೆಯುವಾಗ್ಲೂ ಲಾಂಗ್ ಆನ್ಸರ್ ಇದ್ರೆ ಅದಕ್ಕೆ ಮಸ್ಟ್ ಅಂಡ್ ಶುಡ್ ಎರಡು ಡೆಫಿನೇಷನ್ಸ್ ನ ಬರೆಯೋದು. ಡೆಫಿನೇಷನ್ಸ್ ನ ಸುಮ್ಮನೆ ಬರೆಯಬಾರ್ದು, ಅಕಾರ್ಡಿಂಗ್ ಟು ಹೂಮ್, ಯಾವ ಆಥರ್ ಕೊಟ್ಟಿರ್ತಾರೆ ಅನ್ನೋದನ್ನ ಬರೆಯೋದು ಕೆಳಗಡೆ. ನಿಮ್ಗೆ ಒಳ್ಳೆ ಮಾರ್ಕ್ಸ್ ನ ಸ್ಕೋರ್ ಮಾಡೋದಕ್ಕೆ ಈಸಿ ಆಗುತ್ತೆ. ಅಂಡ್ ದ ನೆಕ್ಸ್ಟ್ ಥಿಂಗ್ ಇಸ್ ದಟ್ ನೀವು ಯಾವುದೇ ಕ್ವಶನ್ ಅನ್ನ ಬಿಟ್ಟು ಬರಬಾರ್ದು, ಎಲ್ಲಾ ಕ್ವಶನ್ ಅನ್ನ ಫಿಲ್ ಮಾಡಬೇಕು. ಓಕೆ, ಮತ್ತೆ ನಿಮ್ಮ ಹ್ಯಾಂಡ್ಸ್ ಮೇಂಟೈನ್ ಅ ಕ್ಲೆನ್ಲಿನೆಸ್ ಇನ್ ದ ಪೇಪರ್. Okay, I know you people are not kids, but even though you have to maintain, some people are there to write like cot and chit and they will do right. So you have to avoid those kind of things. If you are seeing your answer paper, so it should be make the evaluator to feel good. Okay, it should not be feel what is this kind of things I'm seeing. The evaluator itself, they are going to frustrate it. So maintain a good handwriting, neatness, cleanliness in the answer sheets, and as well as if you have a time, put a line. Okay, once you completed the things, put line and go intern to the examination center. Take a black color ball pen. There is no gel pen and all should not use. And as well as main thing is that after finishing all the questions, bubble it in the front page. Okay, so as per your guidance of the in which later in your examination session. Okay, so this is all about the first year should follow, because the first year they don't know what to do in the examination, because after second year they come to know how the examination will be there. Okay, so when it comes to the college level examination, board level examination, there is a certain criteria may differ. Okay, so for that reason you should follow all those guidelines. You can definitely get a good marks, and thoroughly study and go to the examination hall within a half an hour. No need to study. Okay, so you studied before your examination schedule. No, you have to study every day, means that time you should not suffer. Okay, next we can see second year GNM. So second year GNM, we have only four subject: medical surgical first, medical surgical nursing second, mental health nursing, and child health nursing. The next one, syllabus review. When it comes to the medical surgical nursing, I already told you medical surgical nursing is a vast subject. We are going to study about the medical and surgical conditions which is related to the adults. Okay, the next one, in this particular part, we have 14. The first one is introduction, second one is nursing assessment, and the third one is pathophysiological manage mechanism of the disease. Then fourth one, altered immune response, and fifth one is fluid and electrolyte imbalance and balance and imbalance. The next one is operation theater techniques. Here you are going to study about the preoperative, postoperative, and you are going to study about the intraoperative techniques. Whatever the things will be there, scrub nurse role, everything you are going to study in the sixth unit, and organization of the OT and all. And seventh is management of the patient undergoing surgery. And the eighth one is nursing management of the patient with respiratory function, impaired respiratory function, and gaseous exchange. The ninth one is you are going to study about the gastrointestinal disorders, nursing management of a patient with the gastrointestinal GI disorders. The next one, nursing management of a patient with the metabolic and endo endocrinal disorders. Okay, this thyroid and all you are going to study in this particular unit. And the next one, patient with a renal and urinary disorder. 11th unit is renal and urinary disorder. The 12th unit is you are going to study about the neurological disorder. The 13th is connective tissue and collagen disorders. Okay. The next 14th is management of the elderly ಅಂತ ಹೇಳಿದ್ರೆ ಜ್ಯೂರಿಯಾಟಿಕ್ ಕೇರ್ ಏನೇನು ಬರುತ್ತೆ ಅದನ್ನೆಲ್ಲ ಇಲ್ಲಿ ಓದ್ತಾ ಹೋಗ್ತೀರಾ. ದ ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ಫಸ್ಟ್ ಅಲ್ಲಿ ಇಷ್ಟನ್ನ ಓದ್ತೀರಾ. ಸೆಕೆಂಡ್ ಅಲ್ಲಿ ಆಂಕಾಲಜಿ ಅಂದ್ರೆ ವಿಚ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ಕ್ಯಾನ್ಸರ್. ಅಂಡ್ ದ ನೆಕ್ಸ್ಟ್ ಒನ್ ಈಸ್ nursing management of a patient with the disorders of the breast and management of a patient. Third one ಬಂದು ಸೆಕೆಂಡ್ ಅಲ್ಲಿ ಡಿಸಾರ್ಡರ್ಸ್ ಆಫ್ ದ ಇಂಟುಗಮೆಂಟ್ರಿ ಅಂದ್ರೆ ಸ್ಕಿನ್ ರಿಲೇಟೆಡ್ ಡಿಸಾರ್ಡರ್ಸ್ ಏನೇನಿದೆ ಅದನ್ನ ಓದ್ತಾ ಹೋಗ್ತೀರಾ. ಅಂಡ್ ಫೋರ್ತ್ ಒನ್ ಆಪ್ಥಲ್ಮಾಲಜಿಲಿ ನಾವು ಓದೋದು ಕಣ್ಣಿನ ಬಗ್ಗೆ ಐಸ್ ವಿಚ್ ಇಸ್ ದ ಡಿಸೀಸಸ್ ವಿಚ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ಐಸ್. ಅಂಡ್ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಫ್ ದ ಪೇಷಂಟ್ ವಿತ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅಂಡ್ ಡಿಸೀಸ್ ಆಫ್ ಇಯರ್ ಅಂಡ್ ನೋಸ್ ಅಂಡ್ ಥ್ರೋಟ್. ಇ ಎನ್ ಟಿ ಅಂದ್ರೆ ಎಂಟರ್ಟೈನ್ಮೆಂಟ್ ಅಲ್ಲ. ಇ ಅಂದ್ರೆ ಇಯರು, ಎನ್ ಅಂದ್ರೆ ನೋಸ್ ಅಂಡ್ ಟಿ ಅಂದ್ರೆ throat. Okay, you are going to study about the ear, nose and throat in the fifth unit. And the sixth unit is that the nursing management of the patient with the cardiovascular, circulatory and hematological. Here you are going to study about the disorders which is related to heart and the circulatory ಮತ್ತೆ ಇನ್ನೊಂದು ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ಮತ್ತೆ ಇನ್ನೊಂದು ಯಾವುದು ಅಂತ ಹೇಳಿದ್ರೆ ಬ್ಲಡ್ ಡಿಸಾರ್ಡರ್ಸ್ ಬಗ್ಗೆ ಕೂಡ ಓದ್ಕೊಳ್ತಾ ಹೋಗ್ತೀವಿ. The next one is seventh is which is related to patients with the communicable diseases, means the diseases which will spreads from one person to one person another person, right? So those kind of communicable diseases, example tuberculosis, all those things you are going to study various diseases. The next one is sexually transmitted diseases. 8th unit ಅಲ್ಲಿ sexually transmitted STDs ಬಗ್ಗೆ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. Next one, excuse me ma'am. The next one, 8th unit ಅಲ್ಲಿ ನಾವು sexually transmitted disease ನ ಓದ್ತಾ ಹೋಗ್ತೀವಿ. And 9th unit ಅಲ್ಲಿ the skeletal disorders and disease. And 10th unit ಬಂದಾಗ emergency management and emergency and disaster management. 11th unit ಅಲ್ಲಿ ಇಷ್ಟು 11 units ನ ನಾವು ಸೆಕೆಂಡ್ ಅಲ್ಲಿ ಓದ್ತೀವಿ. ಅರೌಂಡ್ 14 ಯೂನಿಟ್ಸ್ ನ ನಾವು ಫಸ್ಟ್ ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ಫಸ್ಟ್ ಪಾರ್ಟ್ ಅಲ್ಲಿ ಓದ್ತೀವಿ. ಅಂಡ್ ಸೆಕೆಂಡ್ ಪಾರ್ಟ್ ಅಲ್ಲಿ 11 ಯೂನಿಟ್ಸ್ ನ ಓದ್ತೀವಿ. ಸೊ ಇದ್ರದ್ದು ಎಕ್ಸಾಮಿನೇಷನ್ ಟಿಪ್ಸ್ ಬಂದ್ಬಿಟ್ಟು ಯಾವುದೇ ಕಂಡೀಷನ್ ಕೊಡ್ಲಿ ಕೇರ್ ಪ್ಲಾನ್ ನ ಬರೀರಿ. ಓಕೆ, ಒಂದು ಕಂಡೀಷನ್ ಕೊಟ್ರು ಅಂತ ಹೇಳಿದ್ರೆ ಅಟ್ ಲೀಸ್ಟ್ ಯು ಹ್ಯಾವ್ ಟು ರೈಟ್ ದ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಪ್ರಾಪರ್ಲಿ ಅಂಡ್ ಯು ಹ್ಯಾವ್ ಟು ರೈಟ್ ದ ಕೇರ್ ಪ್ಲಾನ್ಸ್ ಆಲ್ಸೋ. The next one, mental health nursing, which is related to mental disorders. When it comes to the, it is also one of the specialized area in the nursing. When it comes to the first, we have around 9 units here. So what it will be happen andre, first one is introduction, the second one is history of the psychiatry, the third one is mental health assessment. So now one second, take it done, take that phone and introduction. Here we have 9. So 9 units ಅಲ್ಲಿ ನಾವು ಫಸ್ಟ್ ಇಂಟ್ರೊಡಕ್ಷನ್ ರಿಲೇಟೆಡ್ ಟು ಮೆಂಟಲ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್. ಇಟ್ ಇಸ್ ವೆರಿ one of the subject that if you are not studying properly, not understanding properly, you can't able to write in the examination. So thoroughly you study this subject. And the next one, history of the psychiatry and mental health assessment, how to assess the patient with having they are having any kind of mental health disorders or diseases. The next one is therapeutic nurse patient relationship. The next one, we have mental disorders and nursing interventions. Then biopsychosocial therapies. And next one, we have means the laughing therapy. Okay, music therapy, all those therapies will be there that you are going to study. Then psychiatric emergencies and crisis intervention. Psychiatric emergency and crisis intervention. After that, forensic psychiatry and legal aspects. Okay, total 8. So in that 8, you are going to study about all the Here, fifth unit, you are going to study about all the condition which is related to mental health disorders. You are going to study, and the therapies also will be there in this particular syllabus. Everything you are going to study in this particular mental health. Once again, I will tell you, if you are not studying properly, not understanding properly, you will definitely not able to write in the examination. So study thoroughly. The next one is child health. Child health means pediatrics. So we are going to study about the diseases which is related to children's and their management. We are going to study here also. You can see introduction, growth and development of the child from zero to adolescent. Okay, from each and every stage you are going to study toddler, adolescent, preschool, school age. Okay, like this, how the development will be taken place from the birth to adolescent. Okay, so the duration you are going to study. Then the sick child you are going to study all the things which is related to child and what kind of diseases will affect the child during the early stage of the child. Okay, then disorder and the health problems in a child, that is also you are going to study. And child with the congenital disorders by birth, whatever the disorders which will become, that is what you are going to study here. The next one, children with the various disorders and diseases, whatever the diseases which will become, that is what you are going to study in this sixth unit. The next one is seventh, the child welfare services. Okay, this to avoid the child abuse and all, there is a welfare services will be provided by the government of India as well as the world. So you have to study about those agencies and all in this particular unit. So this is all about the seventh unit. So now we can see the examination pattern. Okay, as already I have explained in the last, the same like that only, the same question paper pattern will be come here also. Charge, when it comes to the third year GNM, so here only two subjects will be there. This is very important. You have to study one regarding the midwifery and gynecological nursing, community health nursing second. Okay, in the first part we have studied in the uh, first year itself community health nursing. In the second part we are going to study in the third year nursing. Okay, so when it comes to the midwifery, it is we are going to study about the mothers, okay, and the gynecological things, okay, from whatever the things which will be related to the antenatal, postnatal, and we are going to study about the female reproductive disease condition, how to manage, okay, and whatever the complications will be there during the pregnancy, after the pregnancy, all the things we are going to how to handle during the pregnancy, everything, nutrition, everything we are going to study here in the first subject of the third year, that is what midwifery and gynecological nursing. The first one introduction, the second one is there is a slight review of the reproductive system, that is also you are going to study. So already you have studied in the anatomy and physiology, again they means 2 year back you will study, no, so once again there needs to recall for that reproductive system, female reproductive, especially particularly female reproductive system you are going to study. The next one is embryology and fetal development, so it is related to embryo and the fetus, okay, and the fetal, how it will grow inside the womb. The next one, fourth unit, normal pregnancy and its management, how to manage the normal pregnancy. Okay, this gestational duration will be there. Okay, so all those things, how to manage during this particular period from last LMP till the delivery date, how they are going to manage, all these things will be learned by the fifth unit. And the sixth unit is management of the newborn after the born of the baby, that is a newborn baby, so how we are going to handle and how the management will be there, that is what you are going to study in sixth unit. And the seventh unit, management of the normal puparium, which is after the pregnant delivery, there is a postpartum will be there, so that is what how we are going to manage, okay, the period, that is what puparium. The next eighth is you are going to see the complications during the pregnancy. Eclampsia, pre-eclampsia will be there. Those are the conditions which is complicated during the pregnancy. Okay. That is what you are going to study in this particular various complications during the pregnancy. That is what the eighth unit. The ninth one is the management of high risk labor. Okay, so after 35 years and all, it will be a high risk pregnancy too, and how to handle the high risk labor. Okay, so shoulder dystocia, if it'll be a shoulder dystocia, there is the risk will be there to deliver the baby in such conditions. So for that and all, what is the management will be there? That is what you are going to study in this particular unit. And the next one, management of complications of the puparium postpartum. And the next one, high risk and sick newborn. High risk and sick newborn, how you are going to give a care for the newborn when it is sick. Okay, the next one, obstetric operations, LICS and all, it will be there. That is what you are going to study. And drugs used in the obstetrics. The last one is ethical and legal aspects of the related to midwifery, related to this MTP Act, and the ethical and legal aspects which will be related to the pregnancy and preparium, whatever it will be, the legal rules norms will be there related to abortion and everything you are going to study here. The next subject, the last subject of your particular course, that is what community health nursing part 2. Here you are going to study about the health system in India, how the health system is rendering in India, in our nation, and healthcare delivery system, how the healthcare delivery system will be there in India. Okay, especially rural level, urban level, everything you are going to study here. Health planning in India, and specialized community health services and nurses role, national health problems and national health programs, and demography and family. Here you are going to study about the people demography and as well as the family welfare things. And health team, hola comes in the health team in the community health sector. And health information system, HIS. Okay, so and health agencies, related to all these important topics you are going to study in the second part. The examination pattern also will be same here. So the conclusion, and the we are have provided you as a balanced blend of theory and practical. See here in this particular type of examination, we have both kind of examination. One is theory and another one is practical. Okay, so you have to attend the practical also and the theory also. Okay, theory paper will be there for a 75 marks. In the 25 marks we have a practical. Okay, so when it comes to the theory, already I have explained you how to write, what to write in the examination, what is the pattern of the examination. And when it comes to this one, the practical. So here there is a two type of one. You have to written examination will be there. They will give one case and you have to go to hospital. You have to present that case. Okay, and you have to attend the viva related to the particular subject and as well as your condition also. So like this kind of criteria will be there for you to attend the examination. And the year-wise syllabus and internship ensure you're fully prepared for all real world nursing challenges. Okay, so well, whenever you are writing the examination or preparing the examination, keep your syllabus with you and start to study. Okay, and continuous growth, which will be the stay updated with the INC guidelines and actively engage in practical learning for ongoing professional development. Don't leave your practice. Okay, so work in the hospital means you, if you are posted for a practical session, don't waste your time, study well and as well as get the more practical exposure. So this is what regarding our crash course on the 3 years of GNM course. Thank you so much for attending, all of you, to get the benefits of this particular crash course, Nursing 9 Bytes.